I would like to extend a warm welcome to the COVID board that is a snapshot of the COVID-19 virus that we're all dealing with. Out of the gate, this is not a get pissed. This is a helpful, holistic, comprehensive look at COVID. We're all trying to prevent COVID, and if you get COVID, you might wind up in the hospital. But this side of the hospital, how do you actually treat COVID? On day one of having COVID, how do you treat COVID? What are the tangible, effective, potentially effective things we can do in our homes? We need to have what? No, it's not for me to say. Let's have the doctor say. If we wanted to extinguish a fire, we took all the proper measures to prevent a fire. But in the event there was a fire, what is the fire extinguisher? When one researches, goes to information or looks at the information coming in, when one searches proactively on how to treat COVID, there's a real simple, common message. Get plenty of rest. Drink plenty of fluids. Take medications that are under the umbrella of pain medications, like Aleve, Advil, Tylenol. And consult your physician. Whether it's Google or CDC or Mayo Clinic, there's a common treatment message. Fluids, rest, pain medication, and consult your physician. Now that we're 2 years in, how many physicians are overwhelmed and bombarded with people calling them, texting them, seeing them, asking them how to treat COVID? So, what if the physicians just proactively said how to treat COVID? And then the physicians have more time in their day to live their life. COVID early treatment theory is a theory that if the streams of news and information were to go to talk to physicians who are being consulted, you can only imagine, all day long, every day, about how to treat COVID, if the streams of news and information were to talk to the physicians 2 years into COVID on how to treat COVID, then instead of all of us calling our physicians every day on how to treat it, if the news and information channels were to interview, correspond, talk to the physicians, everybody wins. We all benefit from a good article about vaccinations. I can't wait for the next article about mandates being removed or being administered. Like, we all cherish that. We all cherish a good study or article about a mask mandate. In addition to that fantastic information, medications, tangible, iodine, nasal washes, zinc, heartburn medication. It turns out some of them are medications you only get in the hospital. So that's why it's CET, COVID early treatment. Thank you for telling me about the next booster shot. And thank you for telling me about a drug that you can get in the hospital. But before I get to the hospital, what can I do to treat COVID on day 0? And by the way, before day 0 even happens, I will prepare my medicine cabinet with the medications or whatever that will help me treat the respiratory viral infection that we're potentially all going to get. That is CET theory. I can't wait for another informational article about masks. And I also can't wait for some more tangible information on how to treat COVID if I get COVID. There's a lot of us out there that will really appreciate that. We will really appreciate that. I had COVID. I went to the hospital with COVID. I had a terrible experience with COVID. Not to get into my personal life, but I had a terrible experience with COVID via the treatment that I took for COVID. That doesn't make me an expert. That doesn't make me anything. What it does make me is I feel very comfortable having this conversation. The treatment I took for COVID was awful. So I'm particularly inclined and cognizant of how do you actually treat COVID effectively and appropriately and safely. My pillows are fluffed for a good rest. I got lots of bottles of water or canteens of water. And I have acetaminophen or whatever the proper term is for Aleve, Tylenol, Advil. Got it covered. Is that all we got after 2 years? After 2 years of COVID? That's all we know? Of course not. That's why they say consult your physician. So the physicians know. The physicians know how to treat COVID. But aren't these physicians just getting sick and tired of being called every day on how to treat COVID? News and information, talks to the physician and the news combined talk to us, and then we'll know how to treat COVID. That is CET, COVID Early Treatment Theory. It's an elementary level theory. It's real basic. It just says, in the event the streams of news and information continues to provide information, tangible, helpful things that help us treat COVID on behalf of the physicians 2 years later who have been treating COVID, will be well appreciated. Will just be well received. Well received. So, go to hearingisfun.com to learn more, or just pass this video on to simply concur, agree, if you agree that CET theory is real. And we should call it good right there, but don't feel like we're not looking forward to another article about vaccinations. Don't feel like we're turning our back on a mask mandate article. I cherish a good vaccination booster update. But in addition to that quality information, that crucial information, please continue to showcase, illustrate, propose, offer solutions, ideas, treatments on how to treat COVID. My closeout statement would be, this is not a get pissed. This is simply trying to be helpful. If this video never makes it anywhere, visit hearingisfun.com to see it there, because no one could possibly get pissed about this. We're not talking about controversial treatments. We're not talking about anything the FDA or anybody could get pissed about. We're talking about, is it throat lozenges? Is it tea? Is it iodine? Is it hydrogen peroxide? Is it heartburn medication? Is it nothing? Let's just say there's nothing that could possibly treat COVID. Then continue to tell us that. Just say, sorry, Charlie, there is nothing possible to treat COVID. Tell us that. Or,
I'd imagine 2 years into COVID, there's some physicians that have some input on how to treat COVID. And I think now's a good time to let the dogs out. Let the dogs out. Let the dogs out. Let the dogs out. If you get COVID, how do you treat COVID? All right. This concludes this holistic, comprehensive approach to COVID, and I hope you enjoyed it. And please join us for another update down the line, because CET theory is real.
COVID Early Treatment Theory.
COVID